Welcome to the channel. Today's video we're going to cover one of the most common problems that baseball players face, and that is that front side shoulder pain. First things first, let me introduce myself. My name is Trey Martin. I'm a doctor of physical therapy in the Orlando area, and I primarily work with baseball players all the way from Little League all the way up to the major leagues, so I see baseball injuries for a living all day. For today's video, we're going to break into a couple categories. One, what is the cause of this front side shoulder pain? And then two, what are some things that we can do to help treat this so we can start feeling a little bit better and we get back to throwing and on the mound pain-free? Alright, so there's a couple different target tissues when we think front side shoulder pain. We can think about the bicep running into that groove. We can think of a referral pattern coming from the backside of a rotator cuff muscle. We can also maybe think lower into like the pec perhaps too, and where it inserts into the humerus as well. But one of the most important pieces in my opinion is how the scapula is positioned and how strong it is throughout the throwing motion. So no one's ever accused me of being an artist, but we're going to go through a little bit of scapular anatomy really quick. So this is a rough drawing of what the scapula looks like. It has a ton of motion, up, down, side to side, tilting, all the things. Primarily for the throwing motion though, we need it to be able to posteriorly tilt and upwardly rotate to keep freedom for the front side bicep line, and then also for where the rotator cuff goes, and so it can move normally throughout the pitch. So let's talk about the scapula really quick in a couple areas that you're going to need to correct, both from a mobility perspective and a strength perspective. So the scapula has all these different muscles attaching to it. A couple ones we want to touch on though is we're going to have, well, let me pause this and get an actual marker. Alright, let's try the red one. So, red marker, this is not all approximate, but roughly we have the upper trap shooting up. We're going to have mid-trap fibers, low trap fibers. We're also going to have a rhomboid running through this area, through the medial border. We're going to have the serratus kind of pulling around, and then we're going to have some of the cuff muscles. Supraspinatus is one to note, infraspinatus running this way too. So I just kind of want you guys to get a feel of some of the pull lines that we're working with here, and so we can touch on one of the key points here. So a couple things for you guys to think about here. If our upper trap gets too strong and dominant, that along with the levator and the rhomboids are going to kind of make our scap to where instead of it being able to upwardly rotate cleanly and also posterior tilt, that's going to cause a little compression, and then you might see that classic like wing pattern that people talk about, so your scapular border is not going to move nice and smooth along the cage. That can cause pinching here in the cuff tendon, and then the bicep will be running up to this on the front side of the shoulder. So that's a factor. Also weakness of the middle and lower trap along with the serratus. If those muscles are weak, we're not going to get that nice smooth upward rotation, so we really want those muscles to be nice and strong. So point number one, mobility through the upper trap, levator, and rhomboid. Strength in the low, mid trap, and serratus. And then also we're going to want global external rotator strength on the backside of this cuff through the infraspinatus and teres minor. Also too, I should briefly touch on the fact that the lat and the pec, those guys are powerful internal rotators of the shoulder, so they can cause this rotation in. If they're super pulling on the front side of the arm too, that's going to make it harder for the scapula to get upward rotation as well, because if we're stuck in internal rotation, it's going to be hard to elevate. So those are also muscles that you want to focus on from a soft tissue perspective. Alright, so now that we've rambled on and on about what this problem is, little forward scap tilting, we need some strength back here, some mobility through this area. How do we fix this thing so you can get back to the mound to throwing pain-free? Let's dive into that. Alright, so let's talk about thoracic extension and pec mobility. One of my favorite, most easy drills to do is you take a big old med ball or a foam roller, you place it right here, middle of the back. Take a couple light dumbbells, super light at first, and then lay into a chest fly like this. I would recommend turning the dumbbells down a little bit, just so we're not getting this pinch straight across. A little down pull here, really open up the pec. Hold this for about a 60 to 90 second and repeat 1 to 2 times. Alright, so if we're going to give the pec some love, we also got to give the lat some love. That's also going to be a big time compressor of the shoulder. That can also cause some of this front side shoulder pain as well. One of my favorite lat stretches, super easy. Grab a ring. You can also do this off a bar, cable. You just need something stable. 99% So the arm that I'm using, the front knee is going to be bent into a 90-90 like such. Here, here, little lean, and then rotate into the position using the opposite side hand to push yourself into a little rotation. That's going to help stretch the lat. I'd also recommend foam rolling the lat and pec as a super easy way to get warmed up to do this, and also the ball drill that I just showed. Alright, so now that we've covered mobility, now we get into strength, and let's use what's called the KISS principle. Keep it simple, stupid. All you need is a little bit of backside shoulder strength. This doesn't have to be hard. You don't need some fancy exercise. Take a cable box here. I'll use my Voltra. You can use a cable, a band. Doesn't freaking matter. We got 90-90 flip-ups like this. I like long duration holds, so you got two options. You can either do just normal 90-90s. I find that to be a little bit irritating if the shoulder's really hostile, so you can also just start with light, long duration isometric holds, 30-second holds at a 90-90 position. We can also do the T position, making sure that this is flipped down. We're going to get a good scapular squeeze. We can work an A position, and then we can also work a Y position. I would say I would be a little careful of going into straight flexion into more like an I pattern. Sometimes that can be a little bit irritable if the shoulder is nice and hostile. So if we keep it along this line, we're not going to get much pinching. Again, 30-45-second holds. Those are going to feel nice on the tendons. If that feels completely pain-free, then start going through normal sets. I would recommend going a little low volume at first, and then building from there, building into volume, adding a little weight, but that's going to help get some shoulder strength back online so we get a better resting shoulder position. Quick 1-minute breakdown of this again, just rehash everything. I would be remiss to say, if you're having significant sharp shoulder pain, you got a clunk, you dove and something popped, go see a freaking doctor. This is a YouTube video. This is not going to fix a serious labral issue or a shoulder instability issue or what have you, Bankart issue. It's not for that. This is more of the, hey, I get this like little rubbing, sharp to dull pain here in my shoulder every time I throw. It's been getting a little bit worse, and I don't know how to fix it. That's what this is. Mobility, stability. We need mobility of the pec, of the lat, of the upper trap, the levator, and the rhomboid. You got anatomy throughout this video. I've shown you where all those things are. Then we need strength of the mid-scap muscles, so the mid-trap, the low trap. That's going to help our scap be able to tilt posteriorly and upwardly rotate. We also need rotator cuff strength, infraspinatus, teres minor, supraspinatus on the top. We need all those things firing to keep that ball and socket in a happy position. Then we got the scap moving nice and smooth. There you go. We got free space, the shoulder can throw, we're feeling great. If you have further questions and you're having some serious help and you need an actual custom plan built out for you, drop me an email, trey@athletedocrehab.com. I work with remote athletes all across the country and even have a couple overseas, so I guess you could say I'm international now. But try this out first, and again, it's not the end all be all. This is just basic principles, mobility, then stability. You can use a bunch of different exercises, but try these out and see if it helps you get pain-free and back to throwing.